Welcome to our talk, A Million Boluses, Discovery and Disclosure of Vulnerabilities in an Insulin Pump. My name is Dina Truxius. I'm working for the Federal Office for Information Security in Bonn, Germany, and my work solely focuses on cybersecurity in the healthcare sector, on medical device cybersecurity, on project management and comedy work.
Hi, my name is Julian Zuleder and I'm Security Analyst and Researcher at ENW Research in Heidelberg, Germany.
So let's start with our agenda. During our talk, we will cover the following topics. So we will start with medical device security, then we will go on with the testing setup, and Julian will give you some insights into the technical analysis. We will then go to the impact and temporary measures section, and finally, the disclosure section. So here comes our disclaimer. First of all, we want to thank Soil, the manufacturer, for participating in the project and providing us with the pumps. The opinions expressed during our talk solely belong to Julian and me and are not necessarily in full accordance with our employees' or organization's opinion. Our talk will focus on security vulnerabilities identified in an insulin pump, namely the Dana Diabecare RS. All exemplifying vulnerabilities affected the pump's proprietary BLE communication and also patient safety. So let's start with part one, the medical device security. So what is a medical device? Within the European area, medical devices are classified according to their primary use and safety risk. Therefore, medical devices are classified in different risk classes ranging from class 1 to class 3. Class 3 is the highest risk class, and implants like brain stimulators or ICDs belong to this class. All medical device manufacturers have to implement processes for risk and quality management. Due to the new medical device regulation, a European regulation, a transparent software development cycle has to be in place as well. All medical devices, except for class 1 devices, have to get a conformity assessment from a notified body. And all medical devices have to have a so-called CE mark to bring them on the German market. So when I translate our legislation for you, a medical device is basically everything a manufacturer intends to be used for human beings in the purpose of diagnosis, prevention, monitoring, treatment or alleviation of diseases or compensation for an injury or handicap. Moreover, medical devices help to investigate, replace or modify the anatomy of physiological processes and allow to control conception. Most medical devices are portable and not stationary. They are expensive and usually have a long lifetime. Although several standards are in place, medical devices often use proprietary data exchange formats to communicate. Moreover, several users, like medical doctors, nurses, or even the patients themselves, interact with the medical device. Normal upgrade processes are often not applicable to medical devices, and it is important to mention that operation is key and essential for patients' lives. The increasing degree of digitalization is associated with an elevated risk of potential cyber attacks. We have network-connected devices in the health sector. There are more and more mobile health applications coming, which are sometimes classified as medical devices. In contrast to safety, cybersecurity is not given priority. But with the new European regulation, the medical device regulation, cybersecurity and the interaction between IT devices and their environment are regarded. In summary, we can state that operation is key with respect to medical device functionality versus security. So, coming to my project work. When I joined the BSI in 2018, there was a lot of rumor and discussion about medical device cybersecurity, especially with regards to pacemakers and insulin pumps and possible patient harm. So I asked myself what can be done and what has been done so far. And the idea of a medical device hacking project came into my mind. I made use of our budget, entertained myself with paperwork, and tendered the project ManiMed, which stands for Manipulation of Medical Devices. The project started last year in 2019 and will end this year in December. the project aims to assess the current cybersecurity state of medical devices and to bring cybersecurity researchers like Julian, manufacturers, and authorities like me to a table. I chose 5 different device categories, namely ventilators, patient monitors, ICDs and their environment, infusion pumps, and insulin pumps. Out of each category, we aim to assess 2, so in total 10 devices within the scope of the project. To further restrict our market research, because we cannot test every device on the German market, I asked for additional requirements, and these are the following. The devices had to be no longer than 5 years on the German market, so quite new devices. They should be highly connected, having as many interfaces as possible for an appropriate attack surface. After picking those devices, we tried to get in contact with the top manufacturers found in our market research and explaining our intention to pen test the respective devices, and ideally ended up with a signed contract. With this, the manufacturer provided us with the respective medical device and/or lab environment and received exclusive knowledge in return. After the security assessment, the manufacturers are provided with detailed reports about all findings, and a subsequent coordinated vulnerability disclosure process is initiated. All findings are published as soon as the vulnerabilities are fixed. We recommend to use ICSMAs, so ICS medical advisories, and closely collaborate with CISA, therefore, and we also recommend to assign CVEs for each vulnerability. So this project aims to increase transparency and awareness. Additionally, the trustful communication and cooperation among all stakeholders is seen as one of the highest goods in our whole process, which is inspired, as said, by a classical coordinated vulnerability disclosure. We believe that the project results, aimed to be published in December, will allow for cybersecurity statements, as well as addressing certain questions and problems everyone is facing in the field of smart medical devices. This project that I'm leading is the basis for the security research on a smart insulin pump that will be shown by Julian, our technical project lead. When we will demonstrate the findings, please be aware that I make use of my legal mandate to inform you about important security updates. My intention is to improve cybersecurity without finger pointing at anyone or anything. I want people to get a feeling, or better, sixth sense, a security sense, a cybersecurity sense for vulnerabilities. So here are the 5 categories that we assessed during our project, and now we will focus on insulin pumps.
Now I will explain some more details about the medical device as well as its medical intended use. Afterwards, we will shortly discuss where such medical devices can be retrieved from. This is followed by the security assessment's methodology and scope. In the following minutes, I will explain the communication protocol of the Dana Diabecare RS insulin pump, which is sold by the Korean manufacturer Sol Developments, as well as vulnerabilities we identified. The manufacturer intends patients to use the pump as a central component of the open-loop therapy system in combination with the respective mobile apps. With these mobile apps, safety-critical functionality of the pump, such as manual administration of boluses or changing the bazaar rates and profiles, is possible. Besides, patients are creating less restrictive ways in controlling their therapy devices, as for example the We Are Not Waiting initiative demonstrated in the past by building closed-loop systems on their own. Further, the Dana Diabecare RS insulin pump is supported by publicly available looping apps, such as Android APS. Insulin pumps are special active medical devices as they are not used by health professionals but patients themselves. In the case of diabetes, these technical laymen often have in-depth knowledge about their diabetes and easily understand the signals of their body when their glucose levels exceed normal ranges. In Germany, insulin pumps are listed in the age register of the German health insurance GKV. In German we call this the gesetzliche Krankenversicherung. Insulin pumps need to be prescribed by doctors, and every prescription will be checked by the GKV and its supporting institutions. Therefore, the pumps are not publicly sold. Even in Project ManiMed, where a national authority wanted to assess the product, we needed to find a way to get access to these devices. In our case, the manufacturer provided us with 2 insulin pumps. Other common procurement problems comprise of sales structures, where the manufacturer directly sells the device to healthcare delivery organizations and medical professionals. Often, no private persons will be supplied with medical devices upon request. Further, medical devices often are procured using public tenders. Specific and highly heterogeneous environments fitted requirements need to be met. Manufacturers then apply for these tenders with respective quotes. Another more technical hurdle is that often complex lab setups are required to assess the medical device. One important thing I want to add is that security assessment shall never be performed in production. There may be the risk of harming patients, which must be avoided at any cost. The security assessment of medical devices is highly specialized and is dependent on the device's medical use case, present interfaces, used technologies, but also assumptions, for example, to its environment. In scope of the test was a proprietary communication protocol between the insulin pump and its mobile applications, which was built on top of Bluetooth Low Energy. In special, the assessment focused on the used and implemented cryptography as well as on the authentication and pairing process between the pump and its mobile apps. The test methodology was a black box test without source code inside. As already told, we were voluntarily provided with the insulin pump. Further, we downloaded the mobile applications from the App Store and Google Play Store. We used basic Bluetooth Low Energy sniffing hardware to capture the communication between the insulin pump and its mobile applications. In the following, we will present the basics of the communication protocol implemented on top of Bluetooth Low Energy. This layer, with all its GATT characteristics as well as the encryption layer itself, are abstracted and only covered where needed to understand the vulnerabilities. I will first demonstrate the normal communication flow we observed between the pump and its mobile applications. We will start with the application layer pairing process. The first byte states whether the message is a request 01 or response 02. We will talk about the names of the keys on the following slides. This and similar figures will present the different encryption layers with different colors. Yellow color states that this information is transmitted in plain. Blue color shows that messages need to be encrypted using the device key. Red color is showing user interaction, and green color indicates messages need to be encrypted with all three keys. Every communication starts with the mobile app sending a 0100 message to the pump together with its serial number. The pump indicates that a serial is matching. Afterwards, the pairing is requested. The pump immediately answers the request and shows a pairing prompt on its display, which needs to be confirmed manually by pressing a key on the pump. A photo of this pairing prompt can be seen here. After having a user confirming the pairing, the pump sends the pairing key to the mobile application, which then may use the key to encrypt messages after requesting a session key. With these three keys, higher privileged requests such as bolus administration may be performed. For now, the three different keys may be a bit confusing. I believe that it becomes clearer when seeing the post-pairing communication flow. The next time the pump and the app are communicating, no user interaction is needed, as the app only needs to send the pairing key to show that both entities are already paired. After requesting a new session key, high-privileged requests can be sent. Here we see the three keys again. The device key is used to encode all messages. The pairing key and the session key are used to authenticate the session. Now that we know how the intended communication and pairing flow is working, we try to circumvent or break this flow. I want to state again that there is a certain layer of abstraction in the following elucidations. There were multiple low-hanging fruits, such as weak or default pins, and even recommendations for using weak pins. The manufacturer stated that the pin's purpose is to prevent erroneous operation of the keypad. As an attacker needs physical access to the pump, we search for more stealthy attacks by remote attackers, as the pump's special capability is a remote control feature via mobile applications. While using the app, we recognized that the app is asking for the pump's lock pin to grant access to the remote control features. While inspecting the looping app's source code, we identified that the developers omitted this check, which alerted us, as this means that the pump itself does not require this check. Further, we did not see any request to the pump for checking the pin. Having a deep dive into the Dana's reversed app code, we saw that the pin is requested from the pump and compared in the app. This is a lock pin disclosure. Further, the app denies using the pin 1234. An interesting find was that a communicating party does not need to be paired to extract the pin. The pin not directly transmitted but can be calculated in the app with information requested. This enables attackers to extract the log pin of every Dana RS insulin pump in his or her Bluetooth Low Energy range. The next finding we want to elucidate is about weakly generated encryption keys. The device keys derived from the pump serial number does not contain any randomizing element and will never change. The serial number can be obtained from Bluetooth Low Energy advertisements. The session key can be calculated from the pump's log pin as well as configured time. We saw the respective request on a previous slide within the pin disclosure. Having these two occurrences of doubtful calculation of secrets, we further investigated all the other keys and recognized that also the pairing key is not random. This key is calculated on the pump, so we had no ability to reverse this calculation. Though we wrote a script that requested pairing multiple times within a second and saw that the same key will be returned. Therefore, we tried multiple parameter combinations for this calculation and finally found the formula to calculate the pairing key being derived from the pump's time during pairing. As a result, any secret of the Dana RS system is generated insecurely. In addition to an unauthenticated Keypad log pin disclosure, no active verification of the pump's identity is present. Therefore, attackers can spoof both communication partners and therefore easily get in a man-in-the-middle position. Therefore, the protocol misses replay protection. Hijacking the Bluetooth Low Energy session, attackers may replay sniffed messages. But the still most easy way to issue trusted commands is to sniff a single communication flow between the pump and an app. We will get into this on the next slide. The whole authentication mechanism relies on encryption using multiple keys. The pairing key is the only key that is needed to issue higher privileged commands, as the session key can be requested by anyone and as the device key is known to everyone without even connecting to the pump. When having a look at the authentication flow, the key is transmitted being encrypted with the device key as marked in the red box. This encryption is completely deterministic and everyone sniffing this communication is able to extract the key. Now we will discuss the impact and temporary measures of these vulnerabilities. To point out the criticality, we prepared a demo for you. The weak pins and recommendations are low-hanging fruit and only pose a risk for attackers with physical access to the pump. The combination of the vulnerabilities in the communication protocol empowers attackers to hijack the pump and use all functionalities that are offered via Bluetooth Low Energy. To exploit this, an attacker needs to be in proximity to the insulin pump, sniffing a single communication between the pump and a paired mobile application. This attack can be performed automatically, and we actually wrote an exploit demonstrating this. The manufacturer prepared an update for the pump fixing the vulnerabilities, but let us get back to this later. Now I would like to present you a short video demonstrating the criticality of the automated attack. A few words are needed to explain the video. In the following video, an attacker captures messages between an insulin pump and a mobile app, extracts the pairing key from this communication, hijacks and terminates the session between the pump and its paired app, creates a new session impersonating the app using the pairing key and administers multiple insulin boluses. The patient notices the administration and cancels it on the pump, but more boluses are following. Currently, we are searching for devices that are having connections to their mobile applications. The script is actively searching for these connections. Once the pump has a connection, as you can see, the script will also recognize this connection and will try to sniff the respective pairing key. I'm only pressing buttons to reactivate the pump's display. The exploit itself does not require any user interaction. As we saw, the pump has no connection anymore as we terminated the respective Bluetooth Low Energy session, and now we are connecting ourselves as the attacker to the pump and are now administering different insulin boluses. The patient now is trying to stop these administrations, and as you can see, this isn't working properly. As soon as he has cancelled the first administration, a second administration will follow, which will continue until the attacker basically stops sending these insulin bolus requests, which is in the case now.
Julian, thank you for this really exciting video. So when we draw a conclusion from what we just heard, we can state that most of the vulnerabilities found in that insulin pump are design defects. The manufacturer collaborated at all time. He prepared and provided an update which was rolled out in April 2020. I will go into more details later. The whole process was accompanied by a FSN published on our regulator's website, the BfArM website. Although vulnerabilities affecting the communication between the pump and the app were discovered, the device could still be operated when disabling Bluetooth functionality as a temporary fix. As mentioned in the FSN, shown on the right side on the slide, the device can be securely operated when the airplane mode is enabled, thereby preserving its functionality. Moreover, the device has several safety features already implemented. In summary, the pump could be used when the airplane mode was enabled to prevent potential risk. I guess you're not only interested in the disclosure itself, but in the timeline, and I will present it on the following slides. So here comes the disclosure part. As stated before, we aim to live cybersecurity and act accordingly. In our opinion, a coordinated vulnerability disclosure process is desired whenever findings are reported in any device. Julian, me, and our team colleagues managed and coordinated the whole disclosure process. We believe that it is essential to identify vulnerabilities in medical devices in an ethical way to strengthen cybersecurity, consumer protection, and patient safety. Thereby, we all maintain a basis of trust to allow for mutual exchange and efficient communication. I have no intention on blaming anyone with this talk. As a project team, we believe that ethical publishing of vulnerabilities is possible, thereby increasing transparency and the willingness to update devices in time. However, it has to be ensured at all time that the publication does not pose serious harm to patients. In our case, short-term measures and workarounds exist and existed, and an innovative device was not withdrawn from the market. So I believe that security and safety are not contradicting each other, and that secure connected devices are pioneering. So here is a table of our disclosure timeline. In August 2019, we assessed this device and handed the detailed report over end of August. The manufacturer announced an update and provided us in November with an updated version of the pump, and we performed the retest. In January, there was an additional test on the Android application. In March, the official field safety notice, so the FSN from our regulators, from the BfArM, was released. In April 2020, as I said before, the firmware update was rolled out in Europe. And in May, the field safety corrective action was publicly announced also by our regulators. Today, in September 2020, we are kind of publicly disclosing these vulnerabilities.
With this talk, we will publish a white paper which elucidates the findings from a technical perspective. This paper will cover only the Diabecare RS findings, as the findings of other products will be explained in the final ManiMed report.
So, although this is a BSI project and in principle all the vulnerabilities found belong to the Federal Office for Information Security, but Julian and his teammates found these vulnerabilities and they should be acknowledged for that. So apart from this white paper that Julian already mentioned, as ICS Medical Advisory, so an ICSMA, will be published by CISA with this talk. So coming to our conclusions. Security updates affecting patient safety should be handled with high priority. All security updates are inevitable to protect against vulnerabilities. So cybersecurity is a continuous process. We have seen also in the whole project that mature processes for handling cybersecurity vulnerabilities with safety impact are not yet common among all medical device manufacturers, although recognized procedures are in place. We believe that a coordinated vulnerability disclosure is the only way to have a trustful basis for mutual exchange, and we think it's the best way to deal with reported vulnerabilities. With our project, with our talk, with our work, we want to inspire authorities and manufacturers in terms of best IT security practice and show the public what is actually ongoing with the cybersecurity state of medical devices. So here comes our outlook. So our research will go on and we will publish in different formats, like in academic papers. We will give some further talks. We will probably publish blog posts and so on, because we believe that there are lots of different stakeholders that are all interested in our project results, not only physicians and diabetologists, but also academia, healthcare delivery organizations, and even other authorities or international stakeholders. So with this, I would like to thank you for your attention, and we are happy to take your questions.
We are really interested to learn about the regulations outside of Europe or the US. So if you have information about medical device security recommendations, regulations or guidances, be free to send us an email. Thank you.